Welcome back, everybody. When your dentist cleans your teeth every 6 months, because you do go every 6 months, don't you? Well, they also check for other things like oral cancer. If caught early, there's a 90% chance you'll beat it. Now there's a new tool in the fight against oral cancer. Please welcome back dentist Dr. Terri Alani. Hi.
Hello.
I want to start off with the importance of doing your checkups regularly, because you're not just looking to see if you have a cavity, which that's important too, but you're looking for a number of things.
Exactly. Nowadays, actually going to the dentist can be a matter of life and death. And let me tell you some statistics that are very alarming. First of all, there is one person every hour in the United States dies from oral cancer.
Wow.
There are 640,000 cases annually that will be diagnosed this year alone. There are 36,000 people that will be diagnosed with cancer, oral cancer, in the United States this year, and there will be 100 cases diagnosed every day in the United States.
That's crazy.
Now, with proper, if you catch it early, there's a 90% survival rate.
Yeah.
But the problem is most of the oral cancers are not diagnosed with the naked eye. So your mortality rate is up to 50%.
Yeah, because by the time you have the lesions, the lump or ulcer, you know, on your tongue or your lip or mouth, or those dark-colored lesions, by the time you see that, it's been there for a while.
Exactly. And what we tell patients, if there is hoarseness, as you know, Michael Douglas has brought oral cancer awareness to the public, which has been great. But if you have hoarseness, if you have an area, a scratched area, an ulcerated area that is not healed with or without treatment for more than 2 weeks, then you must see and bring it to the awareness of the dentist. Now, the dentists are the first line of defense in trying to combat oral cancer.
Yeah, and you know, I can hear a lot of people right now saying, well, you know, I don't smoke, so that's not me. Well, you don't have to be. It can make it work. It can make your chances go up.
Exactly.
But you don't have to be a tobacco user. But alcohol can be something that increases your chances of getting it, and the human papillomavirus can also increase.
The two ways of getting oral cancer, most of all, is alcohol and tobacco, of course, but the HPV-16 virus, the human papillomavirus, and it's transferred through oral sex. And basically, the HPV virus has increased oral cancer 5 times in those patients who are 40 and under. So now, what they're saying is that everyone that is 17 years old and older needs to go to their dentist and have an oral cancer exam.
Wow. Okay. Let's talk about this new technology that can help you detect something far before it's actually gotten so out of hand.
Exactly. And I just wanted to say one other thing. You know, there's the pap smear, the mammogram, the prostate exam. Those exams are screenings that have really helped prevent, you know, the types of cancer.
Reduce the mortality rate.
The oral cancer exam is painless. It takes less than 3 minutes, and you know, it's very easy to do. And basically, it's a device that's called the Identify 3000. And the way it works through wavelengths. The first light, first of all, what we do is we have disposable mirrors, and we put the mirror onto the device. It's so easy to use. We turn it on, and we have a white light. Let me just get this on. The white light, which we actually do the exam in the patient's mouth. We inspect the throat, the cheeks, underneath the tongue.
So what do you see?
Well, hopefully we see nothing.
Yeah.
But what we're looking for is just to inspect any areas that might look suspicious.
Right.
Then there's a violet light, and that's another wavelength. This might be difficult for your viewers to see, but what this does is this highlights any abnormalities that exist in the oral cavity. Okay, and it's through this special light. Now, the dental professional will actually put on these types of glasses. And this allows us to highlight, to see the areas a little bit better. Then, if they're suspicious, then there's another light. It's an amber light, and this actually highlights the abnormal blood vessels that surround the area.
Wow. So it zeroes in on something's not right here.
And what we're trying to do is educate the public and have opportunistic screenings for the patients that are done annually.
Well, it just makes that checkup much more important, because I think a lot of us put it off or get too busy. If we're not feeling pain, we don't go in. But you don't want to get to the point where you're feeling pain on anything.
Well, it saves lives, and that's what we want to do.
Yeah. We have Ann Burns and with us this morning. And Ann, your mom actually invented the Identify 3000. Why did she invent this? Was there a special reason?
Well, she's been an oncologist at MD Anderson for 25 years. She's no longer working there, but she's still producing this type of technology in different areas, cervical mainly. But she came upon this by you know, testing different things. And I remember when I was 15 in high school, I did an internship with her at the hospital. and she showed me this for the first time, and it was just groundbreaking then and groundbreaking today.
Yeah, yeah. We have Andreas Ulaga, who developed Identify 3000, the technology. And so, Andreas, when you first heard about this, it had to be really kind of one of those moments where you get, you know, a little tingling and going, wow, this could actually work in saving lives.
That is exactly right. I was working with her mom as a student, as a graduate student at the University of Texas at Austin, and with other faculty. We're now at Rice University. And I'm a scientist by training, and indeed, it's one of those, wow, you know, this really works. And we can really make something out of this because thanks to the work that we did at MD Anderson and other places, I saw that how an engineer like me, a lowly engineer like me, could you know, make a difference in people's lives. How we could see, you know, disease, maybe help somebody's lives along the way. And that was very exciting for me. That still makes me tingle right now.
Yeah. And Dr. Alani, of course, none of this matters and none of this works if we don't bring our mouths in.
Exactly. Please go to your dentist and actually request. You know, less than 15% of people actually have had an oral cancer exam at the dentist. And from the audience, how many of you have actually had an oral cancer exam when you've gone to the dentist? So you need to ask for it. And we're trying to increase in public awareness from the patients.
All right. Thank you very much. Dr. Alani has a special offer. The first 20 callers will get a complimentary exam and x-rays. The number to call is 713-621-5141, 713-621-5141. For more information, go to her website, Texastoothlady.com. You can also find her on Facebook. Just search for Terri Alani. You can also catch Dr. Terri and her brother, Dr. Wayne Alani, on their radio show, For Your Health, where they talk about health and everything else. It airs on 6:50 a.m. every Tuesday at 1 p.m. Still ahead, negative pressure